Asthma and heart attacks are two distinct medical conditions that often require quick recognition and immediate treatment. Asthma is characterized by symptoms such as wheezing, shortness of breath, chest tightness, and coughing, particularly at night or early morning. On the other hand, heart attack symptoms include chest pain or discomfort that may radiate to the jaw, shoulder, or arm, nausea, cold sweat, and shortness of breath. Treatment for asthma involves the use of inhalers to open airways and control inflammation, whereas heart attacks require emergency medical attention, which might include drugs to dissolve clots and procedures to restore blood flow to the heart. Risk factors for asthma include a family history of the disease and environmental triggers, while heart attacks are more associated with lifestyle factors such as smoking, high blood pressure, and high cholesterol. Here's a detailed look at the nuanced aspects of both diseases, emphasizing the need for proper diagnosis and tailored approaches to treatment. Affected systems: respiratory versus cardiovascular. Asthma primarily affects the respiratory system, presenting symptoms such as wheezing, shortness of breath, chest tightness, and coughing. These symptoms often worsen at night or in response to triggers like allergens or cold air. In contrast, heart attack symptoms involve the cardiovascular system and can include intense chest pain or pressure, often described as a squeezing sensation, which may radiate to the jaw, neck, or arms, nausea, dizziness, and shortness of breath. It is critical to distinguish between the two, as heart attacks require immediate medical intervention to prevent heart damage or death, while asthma is usually managed with inhalers and avoiding triggers. Onset of symptoms: gradual versus sudden. When distinguishing between asthma and heart attack symptoms, the onset of symptoms plays a crucial diagnostic role. Asthma typically presents with a gradual increase in symptoms such as wheezing, chest tightness, shortness of breath, and coughing. These symptoms often worsen over minutes to hours and might be triggered by allergens, exercise, or cold air. In contrast, heart attack symptoms can appear suddenly and are characterized by intense chest pain or pressure, often described as a squeezing sensation, which may radiate to the neck, jaw, or arms. Accompanying features may include sudden shortness of breath, sweating, and nausea. Early recognition and differentiation of these symptoms are pivotal for appropriate and potentially life-saving interventions. Provoking factors: allergens, irritants versus physical exertion, stress. When discerning between asthma and heart attack symptoms, one must consider the provoking factors. Asthma is typically triggered by allergens or irritants such as pollen, pet dander, or smoke, leading to respiratory symptoms like wheezing, coughing, and shortness of breath. On the flip side, heart attack symptoms, though they can also include breathlessness, are more likely spurred by physical exertion or emotional stress. During a heart attack, one might experience chest pain or discomfort, which can radiate to the arms, neck, jaw, or back. This pain differs significantly from the chest tightness associated with asthma. Furthermore, heart attack symptoms can be accompanied by a cold sweat, nausea, or lightheadedness. Recognizing the context and nature of these symptoms is crucial for timely and appropriate medical intervention. Character of discomfort: tightening cough versus pressing, crushing. In distinguishing between asthma and heart attack symptoms, the nature of discomfort provides vital clues. Asthma typically presents with a sensation of chest tightness coupled with wheezing or a persistent cough, often exacerbated by allergens or exercise. In contrast, a heart attack commonly manifests as a pressing or crushing pain centrally located in the chest. This pain can radiate to the arms, neck, or jaw. While asthma-related tightness may improve with the use of bronchodilators, heart attack symptoms necessitate immediate medical attention, as they indicate a potential life-threatening blockage in the coronary arteries, requiring urgent intervention to prevent damage to the heart muscle. Associated symptoms: wheezing, breathlessness versus nausea, sweating. Asthma primarily affects the airways, with symptoms like wheezing and shortness of breath due to bronchoconstriction, inflammation, and mucus production. Patients may describe a tight chest and may struggle to complete sentences. On the flip side, heart attack symptoms extend beyond the chest pain, angina, often associated with myocardial infarction. Nausea, sweating, and an overwhelming sense of anxiety are typical. The discomfort may radiate to the jaw, back, or arm. While both conditions can cause breathlessness, heart attacks can lead to a sudden, crushing pain in the chest that asthma doesn't. It's crucial for individuals and healthcare professionals alike to distinguish between these symptoms for prompt and appropriate management, as both conditions are potentially life-threatening but require vastly different treatments.